Good morning. Good morning, Facebook. Good morning, YouTube. Good morning, Blog Talk Radio. Good morning. It is Friday morning. Good morning. Let's see who's going to join us. Friday morning, July 27th. Let's see who is going to join us this morning on this broadcast. Good morning. Good morning, good morning, good morning. Sorry, we are a few minutes late, but guess who was late? My friend, David. Good morning, good morning, good morning. It is Friday, July 27th. Got some news I'm going to share with you guys in just a little bit, but our broadcast today is going to be about healthcare coverage and crossing the color line. You know, we always got to talk about race, racism, race relations, all the issues that are affecting us here in this country as Democrats, what we're going to do to win these races. We had was a runoff this past Tuesday. We're going to talk about that. We're going to bring our trusty co-host in. Let's see if Mr. John is with us, Mr. David is with us. Let's bring them into the broadcast this morning. We always talk about acknowledging the divide with Mr. John Armwood. Good morning, John.
Good morning, Tamara. How are you doing this fine, hot Friday morning?
I know, right? I know, but you know what? We gotta love summers in Georgia, because I do.
I like winters.
Good morning, good morning. We're gonna talk real candidly this morning about healthcare and coverage and crossing that color line. Healthcare is pretty serious, and it's an issue that affects all of us. But communities of color, access to healthcare is an issue. We need to talk about it. We're gonna bring Mr. David in. David, let's see where he is this morning. He had us late.
Mr. Yeah, you're picking on me. Well, I can't even fight back. I'm in the lobby and I can't even say anything. So, right, okay, I know how these things work.
So CP time.
Hi, John. How you doing?
Hey, how you doing? I'm doing well.
Good morning. Good morning. Good morning. Good morning, David. Healthcare.
The
camera. Both of you guys are sitting relatively low. John, you're sitting over to the left. Like we're getting half your face.
Oh, see, I'm seeing okay. That better?
There you go. Awesome, awesome, awesome. Healthcare, David. Healthcare, John. Healthcare and crossing that color line.
Right.
Okay.
Right.
Yeah, healthcare is an issue that affects everyone, particularly those people who have to live on a salary, which is a large portion of Americans.
A fixed salary.
Exactly. A large portion of Americans are 2 or 3, if not 1 paycheck away from financial ruin. So if you get laid off or you get sick while you're working, you can lose your medical coverage. And then you're without health care. Happened to me in the spring of 2016. I was working, had a good medical coverage, had a good job, developed cancer, and was out on temporary disability.
Uh-oh, he's freezing.
What you have, but you can buy the healthcare yourself if you're if you lose your job or something like that. But the company went, so there was nothing. But for the Affordable Care Act, I may have been dead because I had to have an emergency surgery 2 weeks after the company went under and I lost my insurance. And I called up the Affordable Care Act and got on board and had my surgery.
Yeah, that's a really dramatic, and there are millions of people who are in that situation, and the Affordable Care Act has saved their lives. And you're absolutely right. And that Affordable Care Act has really only been around for about 5 years, right? So before that, and before that, and before before there were any reforms, the 80% of the health coverage in this country well, it's still 80%, is from employers. And what that does is it makes you dependent on your employer, right? So
If you lose your job, you
yeah,
lose your health care.
you lose your job and you lose your health care, and you can lose your house, you can lose your life, as you are, as you were pointing out. So that creates a situation of extreme vulnerability for most people who work for salaries, which is 85% of us or so, right?
Oh
And
yeah, definitely.
so in contrast to that, most wealthy countries have a citizenship right to health insurance, right?
All of
Um,
the industrialized countries. I lived in Korea
yeah,
and taught for a Korean firm for
mm,
3 years. I
right.
got sick. Let me give you an
Mm,
example. We had universal health care. I paid a $60 a month premium as a mid 50-year-old. I had
yeah,
health care. I got sick, really sick. And
yeah,
my blood pressure got out of control. I collapsed in a subway station, train station. I had to be carried by ambulance to the hospital, spent the night at the hospital in the emergency room, working over me, getting my pressure down. And when you leave, like any other medical facility, you go to the office to talk about your bill. And the woman hands me a bill. When it's converted from Korean won to English, came out to like $62. And I said to her, "This is you'll send me the rest in the mail." And she said,
yeah.
"No, this
That's
is it. This is the ambulance,
yeah,
the medications,
yeah,
and the treatment in the emergency room.
yeah,
$60.
yeah. And my parents had the same
Everyone has to
experience
be.
in France as well. When they
Mm-hmm.
when they came to visit me when I was doing my research in Paris, my mom got sick. They went to the emergency room. You know what they said in the emergency room? My dad's French was fluent, and they said to him, "Look, there's an awful lot of paperwork for a foreigner, to fill out. Could you just not pay us?" They said, "Do us a favor." So you're
C'est si
absolutely
bon.
right. Yeah, I mean, so
That's good.
what we're dealing with here is a stark contrast between the way that other wealthy countries and even middle income countries deal with the issue of healthcare. Now, one of the things I wanted to introduce in this hour that we're talking is the idea of a universal risk pool, right? You know what that means, right? That everybody is in the same boat. And one of the things that happens in this country is that because of class and race, particularly the intricate dance between class and race, we have different batches. We have people in different buckets of risk pool. And because we have a private, predominantly private for-profit system of health insurance um, for able-bodied wage earners, what that means is that the private insurance companies are looking for every way that they can to avoid paying out, insurance claims. Right? There are, according to Barbara Ehrenreich, 5 or 6 years ago, when she started to talk about this stuff, there are 300,000 people who work in the healthcare industry whose sole job or primary job is to find ways to kick people off of their benefits, or to find exceptions and loopholes in insurance policies to avoid paying benefits. So this is insane. I mean, it's like we're living in an insane asylum, and the inmates are running that is the big insurance companies are running the insane asylum.
And
So
conservatives always talk about rationing healthcare with the universal system. It's rationed now with these private
yeah,
insurance companies.
yeah,
Right? You can't get the medicine that you need. They
yeah,
refuse to pay for it. And
right,
then you go through all these changes trying to get medications that they'll cover.
yeah. So when we have everyone in the same risk pool, there's a word for that, and that's called solidarity. People who are in the same risk pool are connected with each other, and what it does in terms of healthcare is it provides very, very strong incentives for preventive care, because that's going to keep down the costs for everyone, and there are lots of things that we can, that we can talk about. We know, for instance, that that the largest portion of healthcare is spent on the last 5 years of life. So that's one of the things that we and what is done in this country in terms of technology to extend people's lives when there is no measure of quality of life in that last 5 years is also it almost amounts to torture, for people who are in the end stages of illness and decline. We also know that because of the lack of prevention, we have things like untreated issues for folks like obesity and other
high blood pressure.
What's that?
High blood pressure is a major issue, particularly
exactly.
Among people of color.
Yes, exactly. And those things really amount to a deterioration of quality of life. For people who are over the age of 60, I don't know off the top of my head, I would say that almost half of them have disabilities of some form or another. They can't walk up a flight of stairs without getting out of breath. They can't, do various basic, life tasks, or are limited and such. They can't walk a block, things like that. So and that's not the case in other countries. We spend twice the amount of gross domestic product on healthcare than other countries do
on treatment than we do on preventive care.
Yeah, and we spend twice the amount, and we have worse outcomes. In other words, if you look at just longevity, we are at the low end of the wealthy countries in terms of longevity. And if you look even deeper in terms of quality of life, as I say, with disability and all of that other stuff, it's even worse. So we're paying huge amounts of money and we're getting nothing. We're getting less and less in return, and that's one of the things. So we really need to examine why. One of the things is that those people who are not on private insurance are getting their insurance from Medicare or Medicaid, right? And Medicare takes people who are in the older population and puts the bill onto the federal government, onto the general taxpayer, right? That's what Medicare does. In other words, it takes the people who have the greatest requirements for healthcare out of the private market. So the profits that the insurance companies make are essentially clean to me, right? They don't have to address the issue of everybody in the same risk pool. The riskiest people,
and also they can't negotiate with the insurance companies and particularly the drug companies, so they can buy in bulk. Congress passed legislation keeping them from doing that, and that would lower the cost of drugs. It was amazing to me that my American drugs, like Lipitor for cholesterol, was cheaper in Korea than it was in the United States because they bought in bulk. And that's medical. I mean, this prescription costs are so high here. Even with the Medicare, MetaBlue plans, which are a joint, government private system for handling on the Medicare Part D, it's still, the costs are ridiculous.
Yeah, and that's deliberate. That's not just
Yes.
that is government policy, and it's not just about the lack of negotiation for Medicare. The Veterans Administration can negotiate for drug pricing. So it's not as if it's not as if there is a precedent for it. So that's one aspect of it, but the other aspect of it is the way that property rights are protected by the federal government. Patents and protecting patents costs tens of billions of dollars a year in drugs and others, like intellectual property and things like that. There are different ways of handling that would give wider access. Like, for example, if the whole research and development for pharmaceuticals was handled through a state, that is a federal sponsored system, and all drugs then ultimately, you would phase this in, but all drugs then would be generic drugs. The cost of the drugs would be the cost of developing the drugs would be handled by public-private partnerships or something like that, with subsidies from the federal government, and the pharmaceutical companies would be able to charge a price that included how much it costs to make the pill, right? And most of those pills cost less than 10 cents to make.
And then the cost is passed on to the consumer.
Yeah.
And many people don't take their medications because it becomes a trade-off between, do I buy food or do I buy medicine? Or do I buy sub-quality processed food because it's cheaper than whole foods?
Yeah.
And it's really a major problem, which in many ways is getting worse because the cost of medications is skyrocketing.
Now, here's another aspect of it.
I mean, some medications can cost
$100,000 a year. Oops. John got frozen again.
Yeah, he's got frozen again. I want to kind of bring us full circle a little bit. There's a question. If you can hear me, I hope. There is some buffering that's going on. But Sharon posted a question. She said, do you think that this had anything to do with physicians' lobby groups?
Yes.
Oh, definitely.
Lifestyles at the expense of do no harm?
Oh, definitely. Oh, definitely.
Yeah, there's, I mentioned this book before, Dean Baker's book, Rigged, from the Economic Policy Research Institute, not the Economic Policy Institute, but, the EPRI. Dean Baker says that the wages or the incomes for doctors, lawyers, and dentists in the United States compared to other wealthy countries is double, at least double, which means that there's something going on with the income level of these three key group of professionals in this country that is out of whack. There's a reason for it, and the reason for it is that the federal government and the professional associations in all of these cases have limited access to the profession in two ways. One of which is they don't allow foreign doctors or lawyers to come in and compete, and the second way is they prevent people who are at lower skill levels from doing tasks that they are perfectly capable of doing, like physician's assistants or nurse practitioners can do a lot of things that doctors do. But one of the ways that doctors restrict the access to the profession is that you have to go through a residency in the United States in order to practice medicine here. So you hear of all of these people, immigrants that come to this country who are doctors from their own country who are driving cabs here because they cannot get they can't get into a residency program. So this is a monopoly restriction, and not only is it a monopoly restriction, but it twists and distorts the channeling of doctors into specialty into specialties, because specialties are more high, they earn more, they're more profitable to the individual. So that all of that is creating a situation in which we don't have enough. We have this crazy situation where we know we have all of these specialists and we don't have general practitioners or primary care physicians who could handle most of the stuff. And in most other countries, specialists are also general practitioners, which means that they are much more able to see the whole person rather than just the heart or the central nervous system or the skin or these other ways in which healthcare is compartmentalized. I've tried to find out things for myself. I have to go to 4 different specialists in order to I got a skin rash. What is going on here, right?
So, David, I want to bring us kind of full circle. I want to bring us kind of full circle back to what the topic is. I kind of want to keep us going. Health and coverage, and then crossing these racial lines. I actually found an article that was written in Forbes, and the article says why healthcare is different if you're Black, Latino, or poor. And it says this country is in a state of healthcare denial. Politicians, pundits, and executives proudly declare America's medical care is the best in the world, but it isn't. The U.S. lagged behind other industrialized nations in many important health measures, partly because citizens of certain races, ethnicities, incomes experience poorer versions of U.S. healthcare than others. Right.
And a lot of that, a lot of that has to do with the fact that we have created an entire social welfare system in this country. That is the overall social safety net in this country. That is two-tiered, right? When you're Medicare and Medicaid, in most other countries, there is no distinction between Medicare and Medicaid. You have health insurance. That's it. And not only has Medicaid been stigmatized as being for mostly for people of color, for Black people, but it is also reimbursed at a lower rate than Medicare, and doctors can refuse to treat people with Medicaid insurance. Not only that, but Medicaid is not a federal program. It is organized by the states. So the states themselves make the rules, and they can shrink or expand Medicaid as they see fit. And of course, the places in the country that are run by Republicans for the most part have declined Medicaid expansion, for instance, under the Affordable Care Act. And what that does is, to put it together, it not only it is those are the places in the country, particularly in the South, where a disproportionate number of African Americans live, first of all, and secondly, poor whites are hurt by this as much as African Americans are, and other people of color. So you have a situation in which this is the way that I see that is one of the hidden costs of white privilege, right? You have the privilege of not having health care. And because you're Republicans who are essentially the party of whites, has refused to expand Medicaid, and you end up with
rural healthcare is such a major problem right now. Hospitals are closing. People can live 100 miles in rural areas from the nearest hospital. So if you're having a serious medical emergency, a trauma, you're not likely to make it. Because like you're having a heart attack, you need to be in that hospital within 7 or 8 minutes, or have a medical professional.
John's freezing up again.
oxygen to your brain.
Right, exactly. And and we know that, for example, in Georgia, there are rural hospitals that are closing all over the rural counties in Georgia. I think 7 or 8 or 10 of them. And let me just mention also that those rural hospitals often are the source of the better paying jobs in a rural county, so that you not only do you lose the health care, and create situations in which the medical outcomes are far more costly than they would be, um, um, if people had gotten intervention quickly. But you also end up, losing good paying jobs in the in the area. So it's economically as well as medically, very, very troubling what's going on. Somebody just
Someone just mentioned, that the hospital near them closed, and it was 45 miles to the nearest hospital. I
I
mean,
mean, you're in
it's
a
just
trauma.
ridiculous.
I mean, not only heart attack, but stroke or an auto accident.
Any medical emergency.
The sooner you can get to somebody, not only is it more beneficial for saving your life, but the costs of of getting a good outcome are so much great more reduced than they would be in later intervention. So it's insane. It's another part of for-profit capitalist insanity. And one of the reasons why it's going on is to keep people vulnerable, to put pressure and threat and force behind getting people to go to work. So so you are much more dependent on your boss than you would be if you had a universal right to health insurance, and that is the class struggle. That's what's going on. That's the class struggle.
No question about it. You can't transport your health care from one job to the other. That
Yeah.
keeps people from being able to change jobs, which also reinforces that class structure, because you become tied to that employer because you're afraid of losing your, and it'll be higher cost if you're sick.
Yeah.
It's a much higher cost.
Yeah, exactly. And on top of that, the way that they get us in the 90%, below that 10% that has, that's going to come out on top no matter what, the happens to the rest of us. But for the 90%, the people who think and act white in that in that group of the 90%, think that they don't want to be in the same risk pool as those black folks, right? And this is exactly how the remember the Harry and Sally TV ads
Yes.
from
Oh gosh.
1995
During the Clinton administration,
under the attempted reform under the Clinton administration. Totally code language. We won't be able to go to our doctor. We won't be able to do this. We won't be able. It's all about saying we are going to end up on Medicaid. That's what the message was. So, race really plays a very important role in rendering our whole working class powerless to fight this stuff. Now, on top of that, up until very recently, the unions, the trade unions, the labor movement in this country has had a very, sort of on again, hot and cold, ambivalent relationship to, universal health insurance. Because one of the ways that they keep their membership is because they're in big corporations, auto, GM or something like that, and the healthcare is administered by the union, by a joint union management, corporation. So David, it's a way of keeping their members.
Yeah, David, you remember the Mutual Aid Society?
Yeah,
that both I were a part of. It was part of a corporate, union-run healthcare arrangement. It was part of a union contract.
Yeah. So you're then if you're a union boss, in union administration, this becomes a way of keeping your membership, paying their dues, and where So there has been, now that really comes out of a history which we can go into, because Truman tried to introduce a universal health insurance system, and he was defeated by who? Guess who? The Dixiecrats, within his own party, who joined forces with right-wing Republicans and defeated it. Just about the same time as they passed the Taft-Hartley Act, which attacked the unions and prevented the unions from getting together with each other. So one of the things that happened back then is that health insurance, which during World War II had been one of the ways in which, when there were wage freezes in place, right? Wage freezes during World War II. One of the ways that big corporations used to incentivize, getting workers, attracting workers, was to say, well, we'll cover your health care. And at that time, these are the parents of the baby boomers, our parents. There were, these folks were in their 20s and early 30s. They were perfectly healthy. The health insurance cost the corporations really little, very, very, minimal amounts, because they were dealing with that population. And guess what? As soon as those people started to retire, and get older and get sicker, the health and the corporations began to declare Chapter 11 bankruptcy.
Chapter 11, yes, reorganization, yes.
Which allowed them to,
and so they got to get out of those contracts.
Yeah, which allowed them to get out of those union contracts for taking care of retirees, health insurance. And
someone just posted a great comment about that. That Congress has universal health care for themselves.
Yeah.
I mean, they have a socialized health care system for themselves. But they listen to their lobbyists and interests, so we don't have it. I mean, that's, Congress is, I mean, the hypocrisy of it and the pure corporate ownership of members of Congress couldn't be better illustrated by this. The wealthy are taking care of the wealthy. Most congressmen are wealthy. There are plenty that are not, but the vast majority are, especially in the Senate. And they have that insurance. And it's not just while they're in the legislature. When they retire, they're still covered by it. The government health care. So the rest of us suffer. And the stigmatizing, as David mentioned earlier, of people of color, particularly with Medicaid, has led to a really negative view in most people's minds, as David said, of socialized medicine as a whole. And let's be honest, Medicare is socialized medicine. Medicaid is socialized medicine. Medicare for all is socialized medicine. That is not a bad word. Every capitalist country in the world, except these United States of America, has a socialist universal health care system. Some things government does do better. The best government is not the smallest government. Healthcare is done on universal level. Why? Because it's
breaking up again a little bit.
Yeah, let's answer some of these questions, David. David and John. John's freezing up a little bit over there in his frame. You're back, John. Can you hear us? Okay, we can see you, but you keep freezing. Yeah, he's frozen again. So let's put this comment up, David. You can. It says, in Atlanta, why is it perceived that people of color are found at Grady or Atlanta Medical, whereas whites are dominantly found at Emory and Northside? What's your comment on that, David?
Yeah, well, this is part of this. Not only is it a two-tier system in terms of income, and different status, but it's a racial two-tier system as well. And the racial two-tier system actually feeds into this into disarming or undermining the ability of European American working people to see their interests as workers as opposed to their interests as whites. And that really is an important formulation for people to think about. It's not that they're going against their interests. It's that they're going against their interests as working people, and in favor of their interests as part of the white race. So, it's really it's not as simple, and people are not as stupid as that other formulation makes them out to be. That is European American working people. They really are faced with that cloud of I want things to be done by the government, but as long as I'm not treated like a black person, right? So
definitely.
Huh? Yeah.
No, I just said definitely 100% on that. That's what's going on, and the corporations vision, as they always have, as a way of keeping more profits in their pockets.
Yes.
Can you hear me clearly? I know I was breaking up. I switched Wi-Fi lines.
But
can you guys hear me? I lost you. I can't hear.
Not frozen.
Oh.
Can you hear us, David?
I can hear you now. No, I don't know if I can. I just heard that.
Yeah, so yeah, technology, y'all. So yeah, we are discussing again. Call in. I put the call-in number on the screen. It's 929-477-3442. Again, 929-477-3442. Call in, talk to us. We always can, keep going with the conversation, but we definitely would love to hear from you too. We're having a lot of technical difficulties this morning, so I apologize for that, but hopefully we'll get through this broadcast and you'll be able to hear us all the way through. John?
Yes, ma'am. Can you hear me?
Yeah, we can hear you now. It's just coming and going, but it's nothing you and I or any of us can do about it. We just have to keep going.
Yeah. So the question for me becomes, strategic do, David, Tamara, that's where we are right now so we can move forward.
Yes.
I operate assuming that we can.
Yeah.
What specific policy changes, David, would you advocate right now? We have an election coming up, state, local, and federal in November. What can we do?
I would say that the first thing is that that there is I think there's a plan on the table from Bernie Sanders to gradually expand Medicare to younger and younger age categories. All right, expansion of Medicare, expansion of CHIP until we get to the point based upon the principle of that this is a fundamental human right, that it should be guaranteed. I mean, the Declaration of Independence says life, liberty, and the pursuit of happiness. They are inalienable rights. And if you're sick, if you're, and you are in fear for your life because you don't have health insurance, you can't have life, liberty, or the pursuit of happiness. So this is an inalienable right. And on the basis of that, we need to put forward an expansion of the Medicare system so that it covers everybody, and not create two-tier systems like the one we have in place now with Medicaid. That's another thing that we could possibly do, which is to convert all Medicaid into a federal program. All right,
folded into Medicare.
Huh? Folded into Medicare. Yeah. In other words, folded into Medicare, so that it is a federally funded, forgetting the entitlement, right?
Exactly. Yeah. And understand, folks, we all, even on Medicare, we pay a monthly premium for Medicare.
Yeah.
I mean, it's not like it's free. We pay it. And if you're extremely low income, you can qualify for some prescription assistance, but you have to be destitute.
So
to really get that.
you're investing our wages in both our Social Security and our Medicare coverage, right? That's what
Oh,
that's what,
definitely,
huh?
definitely. It's a promise from
Yeah,
one generation to the
yeah,
next, basically.
exactly. So, and this brings up another really important issue I want to get to in a minute. First, I want to say, John, you're absolutely right about the efficiency of this socialist system. The administrative costs for Medicare are around 3%. The administrative costs for private health insurance are around 12%. It's a
Hmm.
no-brainer. In fact, that's one of the reasons why in 2009 and 2010, when the left wing of the Democratic Party was trying to introduce what they called a public option. Remember the public
Oh
option?
well.
That,
Oh well.
that they went crazy. The Republicans and the hospitals and the insurance companies went absolutely crazy because they knew that it would outcompete them. The public option would essentially gobble up the entire private insurance market, and good, is what I
Yes.
would say, because that would have been a really major way to shift the whole conversation. So now there are two things about how to proceed. One of them is that every Democrat has got to support universal health insurance. If they have any doubts, if they have any limitations or restrictions on that, we should withhold the vote. Okay.
Definitely.
I
Hold them
mean,
accountable.
this is either you're going to be there or be square, right? I mean,
Oh
this.
yeah. Oh wow. Oh yeah. Go on. Go on.
I don't know. That's
You know,
probably
David's referring to an
question
old
that
New York
sounds
disc
really
jockey
right.
from the 50s. Symphony said, "Be there or be square."
Yeah, so the other thing that I was going to bring up is that when these benefits are under the control of the states, they are more likely to be restricted by the state governments, and we just have an example of that in Kentucky. Kentucky's former Democratic governor, I think his name was Jim Beshears, introduced the Medicaid expansion program into his state. It was called Kentucky Care or something like that. People didn't even know that it was the Affordable Care Act, that it was Obamacare. But in fact, it was. And this new right-wing Republican governor has come in and is trying to cut away at it, by saying, well, all able-bodied people who are on the Kentucky Care have to apply for work and be working. And you can hear in the logic of Bevan's argument what he means by that. He means we need to coerce people to go to work. We need to force poor people because otherwise they get lazy and they. I'm sorry, I'm getting I don't know what to
And
do.
it's forcing sick people. I mean, if you are disabled and you're trying to get disability, it can take 2 to 3 years or more. And this is not an exception. This is the rule and to get disability. So people have to work during this time. So taking away and then when they work because they have to eat, that is used to penalize them and kick them off. And that is a major problem with the system because conservative government, has put so many obstacles in the way of the implementation of the federal programs that exist. It's doing away with them through obstruction.
Just because you're cutting in and out, so sometimes I
Oh,
don't
I'm
know
so
what.
sorry. Yeah, go ahead. I'll stay out. Yeah.
But here's the other point. This creates a vulnerable working class, a more vulnerable working class than it has to be, and it means that people are more dependent on their bosses. They will work for lower wages. They will tolerate worse conditions, and that means more profits, as you say, more profit in the pocket of the elites. Now, there's another part to this that I think is really important to keep in mind. When wages are low, and skill levels are low, creating a workforce that is more vulnerable to and whose wages are low because they are more vulnerable. Guess what happens? There's less tax money available. Your federal income taxes, that is the FICA taxes that go to pay for Medicare and for your Social Security, are going to be less. So if you're a working person who is particularly if you're a working person who's over the age of 65 or 66, which is when Social Security now cuts in, actually Social Security, we should be expanding Social Security downward as well as Medicare. What's happening is you are narrowing the tax base for your own benefits. Those people who are working today are paying our benefits. It's an intergenerational bargain that we have. So you would think if you were a person who was on retirement, you would want wages to be as high as possible, skill levels to be increased as high as possible, so that the workforce, which is smaller, it's shrinking in comparison to the retirees, will be able to sustain us, right? I mean,
and that's very important.
Yeah.
And that ties into the immigration debate. We are producing less children. Fortunately, because of immigration, has a larger population of young people than most advanced nations, because we have people pouring in. The more immigrants have in our country who become citizens, the more money we have in the pool to protect us as generations grow older. I mean, we're in the bowls now where the baby boomers are getting old. There are less children coming up. When our children get into their 60s, and that's 20 years from now, speaking for myself, there not going to be enough kids to support them. So unless we take care of our immigrant population that is in this country, grant them citizenship. I mean, these are hard-working people. They work hard. If they're citizens, they're contributing to the funds that pay for Social Security and Medicare, Medicaid. It expands the pool. We need this because Japan in particular and many countries in Northern Europe are really having a problem because of the shrinking birth rate.
In Europe and the United States are actually cutting working people's throats when they stop, or try to prevent immigration or create circumstances in which immigrants are more vulnerable than they would be otherwise. Now, there's another aspect to this that I think is really important. We know that one of the great job creating engines in this country is small businesses, right? Maybe 60% of the workforce is in small businesses. Small businesses cannot afford to provide health insurance for the most part for workers unless they're a small business which has very, very high paid, high skilled workers. Okay, so if you have a universal health insurance system, that cuts out a risk for people who want to open their own businesses and for people who want to work for people who will open their own businesses. It is a tremendous reduction in risk, which means that that the employment rate will expand. The unemployment rate will go down. The demand for workers will increase, and the wages will go up, which is exactly what the corporations don't want. All right.
And the funny thing is, corporations would benefit from this because it would be a cost that they wouldn't have to carry. One of the major reasons that during the 70s, 80s, and 90s, that Asian countries like Japan, the Republic of Korea, Taiwan were able to come into the American market with lower cost electronics, lower cost cars, was because they have national healthcare systems. So the companies didn't have to bear the burden of healthcare, so their costs could be lower.
Those costs were being passed on to anyone. They were just more efficient in their healthcare system. And that's you're right, John. I remember reading somewhere that the cost of an automobile, a General Motors automobile, was something like 5 or 7% of it was health insurance, right?
Yes, definitely.
What's that?
I said definitely, and that adds a lot to the bottom line of the cost of a car.
Yeah. So here you have, people are, the Republicans and Trump are saying, well, we got to get more competitive. We got to get more competitive. What do they mean by that? Drive down wages, eliminate benefits, do all of that other stuff. Yeah, what you'll get then is you'll get a workforce that is a working class as a whole that's intimidated, threatened, sicker, and more stressed out. And the productivity of people that are in that position is not going to go up. So you're absolutely right. But it is the habit of terroristic management is the way that I would describe it. It's the habit of terroristic management that you win by intimidation and threat rather than by incentive. And by the way, the incentives, the positive incentives for the 10% are all there. They're swaddled in cotton, and and they're motivated by tax deductions. And as I said, for these licensed professionals, in the 3 categories of lawyer, doctor, dentist, by protectionist policy.
Almost definitely, yes.
So I'm sorry. I heard
the internet connection is really bad. So I tried to go to another location to the setting, and the internet here is not working well. So I want to apologize to everyone for me cutting in and out like this. I will go back to the way I was doing it before next week.
Okay. All right. So anyway, that becomes, we can see that structurally we need a transformation, and the power to make that structural transformation has got to come from the working people. And in order for the working people to have the power to impose those changes on the ruling elite and on that upper 10%, we have to have solidarity. We have to stop thinking of thinking and acting. We, meaning, those of us who are in that category, have got to stop thinking and acting white and think and act like working people, which we are.
And that's crossing the color line, David. We're at the top of the hour, and that's crossing the color line in healthcare and coverage. And that is how we actually win as Americans. We get beyond, the smoke and mirrors of black and white, and and all the divisiveness that's happening now politically. This is how we win, and this is how we make one America: Medicaid, Medicare, universal healthcare, making sure that everybody has access to healthcare. That just doesn't make sense, David. I just want to say, can you hear me, John? I know you're freezing.
Yes, I can hear you.
Yeah, we can see you. You're very still, but you're frozen. You're coming and going. I think this was a phenomenal broadcast. I was actually going to make an announcement today. I think I'm going to save it for another week. You guys something to come back for. I want to thank my trusty co-host, Mr. David Slavin and Mr. John Armwood, for always having these conversations and having them out loud where we can address the issues and we can win as Democrats. We're all in it to win it. David and I can't talk candidly about acknowledging the divide and this racial divide that exists here in this country. Our goal is to bridge that divide and work in solidarity, get beyond the color and work, as working people and work in solidarity. John Armwood and I, we talk about withholding the vote. We're not out on a witch hunt to get anybody. We're just going to hold candidate and elected officials accountable to the issues that affect communities of color. And we cannot shame and guilt people into voting. We cannot talk at them. We have to talk to them and bring them along according to their own interests. So John and David, I want to thank you for sticking and staying and continue to do these broadcasts. And we're going to see you guys next week. And I will make an announcement then. Stay tuned. Stay tuned. Thank you guys. Thank you, David.
Yeah.
Thank you, John.
Thank